40 to 80% of children with autistic spectrum disorder, ASD, have trouble sleeping. Until recently, few studies have been able to genetically link ASD and sleep problems. However, a groundbreaking new study attempts to prove this association. Sit tight, because this video will take a look at this study and highlight how those with ASD can improve their sleep. What does the latest study say? The study revealed that children with ASD had a higher frequency of copy number variants, CNVs, in 1,053 genes linked with insomnia, and 312 genes that modulate the circadian cycle compared to their siblings unaffected by the disorder and unrelated participants. Surprisingly, the study indicated that only 39% of autistic participants experienced insomnia symptoms. The results baffled researchers, as all participants had an insomnia-associated genetic abnormality. What were the parameters of the study? Researchers believe a study design flaw was responsible for this unexpected finding, stating that databases used for the analysis lacked detailed information necessary to identify changes in sleeping patterns. Questionnaire data focused on one aspect of sleep, the total amount of time spent in bed, ignoring other elements, such as the duration of REM sleep and the amount of time the subject wakes in the middle of the night. Also, databases neglected to include details surrounding the use of sleep aids and sleep hygiene practices, like melatonin supplementation and management of electronic screen time. Also, it can be speculated that genetic abnormalities may not necessarily translate to sleep troubles. This belief can be due to insomnia genes contributing to ASD in ways that are not directly related to sleep, as the circadian rhythm modulates many biological functions, including cognitive functions and hormone production. Genes associated with insomnia are only moderately active in the hypothalamus, the brain region responsible for regulating sleep. It should be noted that these genes are more involved in other areas of the brain. Furthermore, insomnia-linked genetic mutations are more associated with psychiatric disorders than sleep problems. What are some of the issues with collecting data? Assessing insomnia in children, based on parents' reports, can be problematic due to data inconsistencies. Parents may be aware of bedtimes, but not actual sleep times, or if sleep was fragmented. A sleep study using actigraphy may help clarify sleep patterns, but using this type of device may be problematic for ASD patients. Keep watching, because we're going to give you some tips on managing sleep for kids on the spectrum. 1. Maintain a relaxing sleep environment. An autistic child may have an easier time sleeping if they have familiar sleep aids, such as a soft blanket or a favorite stuffed animal. Try reading your child a bedtime story to make them feel relaxed and ready for sleep. A relaxing bedtime routine always helps. 2. Reduce environmental noise. The sounds of everyday household activities, such as the television or music, may be overstimulating for autistic kiddos. Reducing these sounds when it's your child's bedtime can improve sleep. 3. Use dim lights. It's not unusual for children and adolescents to fear the dark. However, an excessively bright light can keep your youngster from sleeping. Instead, try a dim nightlight. 4. Try melatonin supplements. Melatonin improves sleep for children with autism. Typically, melatonin makes it easier to fall and stay asleep. You must see a sleep specialist before starting melatonin supplements. If you try the aforementioned tips without success, speak to your doctor. Help is available.